So most private and some public vaccination sites have closed in Gauteng as well as in KwaZulu-Natal, and this is obviously due to ongoing unrest and looting. Many shops as well as businesses have also shut their doors, with people fearing for their lives at this point. Here's eNCA's Heidi Giokos, who went to some of the vaccination sites and gave us this report.
It's going to be a very massive task.
The vaccination rollout in Gauteng and KZN has suffered a huge setback because of the rioting and looting sweeping through both provinces. This vaccination site in Soweto managed to open, but not even 100 meters away, looting continued unabated. The situation is dire and many people are afraid of risking their health or safety.
It is difficult now to continue with the vaccination in some of our communities. The vaccination program is not going the way it was happening. Even the health services in some of our areas, we have health workers unable to go to work and the ambulances unable to operate. Also, some of the health services basically not able to operate. So at this point and in time, the main focus is just to make sure that the looting stops.
Some of Discovery's private vaccination sites have shut down, which means thousands of vaccines cannot be administered.
Countrywide, yesterday we did 50,000 less vaccinations as a country than we'd been able to get up to last week. Last week we were getting up to 200,000 vaccinations a day. Yesterday we did about 146,000 vaccinations a day. So this is not isolated to Discovery. From a Discovery perspective, it'll obviously be the four main sites across Gauteng. So one Discovery Place, Gallagher Convention Centre, Centurion Virgin Active and Broadacres Virgin Active, and then the two Virgin Active sites in Cape Town. Right now, Discovery is vaccinating at around about 8,000 people a day across our sites, and you're bringing this capacity offline is obviously very disappointing.
Momentum has decided to keep only its Western Cape branches open.
Closing a centre, you're also protecting people who are having to travel to the centre, the staff, as well as the people who have to come in for the vaccines, but you're also jeopardizing the people who need a vaccine.
Given the alarming number of the new COVID-19 cases in the country, concern is mounting that matters will only get worse, especially if vaccines aren't being administered quickly or at all. Heidi Giokos, Soweto.